Please open the slide. Most important part of everyday life. You will see the patient have low backache continuously for a very long time. And then you will find that the patient having serious pain and it becomes lot of disabled. It's $1 billion market, lot of surgeries are required. People become deficit, they become paralysis. So this is a treatment which has to be done very nicely, beautifully, and please do not take any unnecessary risk while treating this type of patients. They have taught us how to do it with the prolonged therapy. I will teach you with the dry needle. Okay. Next. So low back pain can be because of lot of reason, coxalgia, irritation of the gluteus maximus, long back extensors, affection of the superior inguinal ligaments, tightening of the perivertebral muscles, as well as radicular symptoms. So there may be many other reasons. It is not only the slip disc which creates the pain. There are many other reasons by which low back pain can occur. We have seen various reasons by which such pain can occur in our case. We must identify which case it is. Coccygia is generally a genetic pain. Next, blockage of the sacroiliac joint at the L5 facet. So you will see at the whenever you see the L5 facet, there may be some block over there. So you will see where the L5. There are one L1, L2, L3, L4, L5, L5, S1. So there is a stiffness in that black joint. So you will see in the picture how to insert a needle and then how to release the pain. Radicular symptoms are there, complaining of originating in disorders of the ureter, referred pain originating in the segmental process, tumors in the lower abdomen, instability at the lumbosacral transition. When you don't get the recovery at a long time, please advise ultrasonography for the whole abdomen. We are not going for a local anesthesia. Next slide. We are seeing the finger, where to in the pictures. Let us go in the picture. Yeah, these are the pictures. So insert the needles over here. From before also I said, insert the needles over here and do not use KWD, use brain muscle pain, which revives the immediate spasm. Frequently, this sciatica pain also comes about the side of the hip when they are lying down. So whenever you see these people are lying down, they have a sciatica pain, especially in lying down position. And tendinopathy is the greater in the trochanter area. So you will see in a trochanter area, which is near the hip joint. You can see me, it's a hip joint. In near the trochanter area, you will find a severe pain while they are sleeping. Commitment treatment of sacroiliac joint dysfunction. So how to remove this pain? You can see here this. And this is generally because of the piriformis syndrome. Piriformis syndrome generally occurs because of the pus having in the back area. You can see sciatica irritation after the gluteus medius. Differential side diagnosis. See, if there is a nerve compression, it is sciatica irritation. If there is no nerve compression, it is no sciatica irritation. So, in piriformis syndrome, either one has to exist. If there is L5S1 compression, this is a sciatica pain, which is at the gluteus region. And if it is in the piriformis area, there is no disc lesion. There will not be any strip disc. Am I clear?
Yes,
Am
sir.
I clear?
Yes, sir.
Yeah.
Yes, sir.
Yes.
Go to the next slide. Never use this technique because this is for the anesthetist to do it. If you make a mistake, patient may suffer. Right? And local anesthesia relief is only for a local time. But if you do carefully all this technique with acupuncture, you will get a better result. So the points. Yeah, these are the points.
Piriformis.
Insert the needle and stimulate. I have treated a large number of patients who have recovered from this side of pain. There is nothing like, you cannot see. I'll show you today how I have recovered a fibromyalgia pain in just 15 days. What are the indication? Diffuse pain in the hip joint, pain accompanying in the hip arthrosis, adjuvant treatment in the necrosis of the femoral head, treatment after replacement of the hip arthrosis, and treatment after the femoral neck fracture. So this happens because after the femoral neck fracture also, you will get periarthritis procti. And coccytitis pain also, and metastasis in alter patient also, you will find this pain. You can see this pain. These are the points. There is very much less risk while you play with the dry needle. Put the dry needle, stimulate, and you will see pain gets immediate relief. Therapy through muscles, tendons, and ligaments. So you'll see now how we give therapy through muscles. Tendinopathy and the adductor muscles near the pelvis. You know where is the pelvis joint? Yeah, in this pelvis joint, we see lot of pain is there.
وإذا حضرت صاحب الأولياء الأولياء والشهداء والصديق بسم الله قاصد إلى
So there should be two differential diagnoses from this one. It can be either obturator irritation or inguinal or femoral hernia. So it may be hernial pain also. So how to treat the pain? You can see this. I made the material very easy for you. Need not to go for all this. See. Good evening. Hello. I'm fine. Sit down. That's it. So thoracic and lumbar syndrome, especially in patients, chronic lumbago without radiating into the legs, painful spinous process, lot of in the thoracic area you will find respiratory disorder. Patient will not find the difficulty to breathe, and then the lumbar area is retroperitoneal disorder. So this may be the indications. Generally, it will be, you will find a lumbagosciatica pain. So, and when it is in long back extensors, how to treat it? Check. No need anesthesia, please. Here are the muscles. So you have seen how Treatment is given through tendons. Now we'll see treatment through nerves. This is the obturator nerve. Irritating hip pain by hip arthrosis, necrosis of the femoral head. You'll find that the femoral head is necrosized, and femoral and phantom pain you will see. Persisting pain after surgical treatment and inguinal hernia and femoral pain also can be seen in this case. So how to do? Please see to it. One finger laterally, cubical tubercle, one finger with distally, orbital nerve. You can see. You have to just study very little bit with one point and put another point and turn the point next to it, the pain will release. So we have learned about all these things today. We'll close this slide and we'll discuss some points which are required for the recovery of the patients. Please close the slides and ask me your questions. Ask question. Today you can see how I have recovered one patient of fibromyalgia. You can see in my Facebook, the video has been uploaded. You'll see. Fibromyalgia is most difficult disease. She was having tailbone pain, all these pains. And you can say in 15 days, she has become totally nil by using all these points. So she is speaking in Hindi. So anyone will like to translate it into English? Anyone? Anyone will like to translate it into English? Go to my Facebook. And then you will realize how easy it is recovered to. This is the video. And one more video I like to show you a spinal cord injury.
This
Please
video,
come down.
sir?
Yeah. Did I show you the video of the spinal cord injury yesterday? Did I show you the video of
Yes,
the
sir.
spinal cord injury?
Yes, sir.
Then this is the video of today. You can see. Sastri, Hyderabad se. Often we get cases of fibromyalgia which are not recovered, and she was one of them. Where was your pain? आपका दर्द कितनी जगह कहाँ पर?
बैक C3, C4 और C4, C5 के बीच में यहाँ पर.
यहाँ पे था और बाकी यहाँ भी था.
And I was not able to work with my hands also. मेरा हाथ से भी कुछ काम नहीं कर सकती. Swelling बहुत थी, pain बहुत थी, कुछ भी नहीं. पहले दूसरी जगह पर मैंने फिजियोथेरेपी 1 मंथ के लिए लिया था, लेकिन 2 दिन के बाद ही फिर वापस आ गया सब कुछ. उसके बाद मुझे ये हॉस्पिटल के बारे में पता चला था, तो यहाँ आया. 1 मंथ बोला था डॉक्टर ने. 1 मंथ के पहले ही वो like the pain, I got relief from the pain. Just 15 days in a 1 month also.
So, can anyone translate what she has spoken? You are unmuting so many mics. Unmute the mic. Now, can anyone translate what she is speaking? Can anyone translate? Okay, I'll translate. She is a chronic patient of fibromyalgia. She was having chronic tail pain to complete lumbar pain. Even her ankles were having pain, cervical. She could not even lift her shoulder. And after 15 days, you can see what is the result. Play.
Alternate day. So afterwards, he just told to continue for 1 week, alternate day. So now it's completely normal and I'm able to do all my household works. Thank you so much, doctor.
Here you can see this
And
is
I can do the exercises also, physiotherapy.
now you can see this is a case of fibromyalgia which has been recovered from this treatment. Thank you so much.
Thank you.
I always say read little, try to practice more, and you will get what? Understand more. So whenever you practice about brain stimulation, these things, you'll get to learn a lot of things because lot of problems are coming which cannot be solved with medicines. Medicine can only solve 10% of the problems or 20% of the problems. But after that, in chronic stage, there is no problem. So please ask your questions. I told you little so that you can go and practice.
Good evening, sir. This is Anand Maurya from India. I have a
Yes,
question.
tell me, Anand.
Sir, in the slides, some points are mentioned that is called the primary indicated injection points.
So in primary injection points, you have to insert the primary needle, the first needle.
Okay.
This is what I wanted to teach you people, that your colleague also, that this is how you can recover your mother.
Okay.
Because these are the points which we found out that they recovered, they made a very severe pain.
Means the main point which are causing the secondary pain.
Yeah, these are the main pain which are not getting the secondary pain, they get the majority of the pains.
Okay. That means we are going to insert the needles on that point.
Yeah, and then other needles are also to be inserted, touch the pain, and then insert. Or put the if you have a KWD, you may use KWD also. It's up to you. But I always prefer pen because it gives very small stimulus and quick recovery. Patient wants faster recovery. If you are able to bring faster recovery in the patient, you will win the faith of the patient.
Yes, but there is, for example, there is a 3 primary points where we actually place the pen and which needle is going to hold by the hand.
Actually, primary point has to be inserted by the pen, touched by the pen, and the other points has to be touched by the fingers.
Means the pulse is going from the primary injection point to the secondary point.
Yes, you are right.
Okay, sir. Thank you, sir.
Now you can see such a complicated subject. How easy it is. It's a subject of anesthesia.
Yes, sir. It's too easy now.
And I made it into prolotherapy. Now if you come, I'll teach you how to use dextrosaline Only dextrose saline. With soda bicarb, how do you recover all this pain?
Dextrosaline means it is a combination of
PNS,
the
no combination, no nothing. Only a little bit soda bicarb. Pure dextrose. Try to make your practice as simple as you can so that you can grow by your practice. अभी दिल्ली में प्रैक्टिस का क्या हाल है आनंद?
प्रैक्टिस पहले से ठीक है और इवन जो कोरोना का डर था वो तो खत्म हो गया।
पेशेंट्स कितने आ रहे हैं फिर प्राइवेट?
प्राइवेट पेशेंट्स सर प्राइवेट पेशेंट्स भी ठीक है। मैं इवनिंग में बैठता हूँ, मैं जनरली 6:30 में पहुंचता हूँ घर में, फिर 7:30 आपकी क्लास करता हूँ मैं।
लगभग कितने आ जाते हैं?
मेरे पास 15 to 20 पेशेंट होते हैं, मैं 3 आवर्स के लिए बैठ रहा हूँ बस। बट जो न्यूरो केस है वो तो क्लिनिक नहीं, वो तो ऑन विजिट चलता है। न्यूरो में रिजल्ट अच्छा है सर, मैंने वीडियो शेयर नहीं किया बट डेफिनेटली मैंने ब्रेन मसल्स एंड कॉग्निटिव पेन को यूज किया, रिजल्ट बहुत अच्छा है।
Why you speak in English?
1 minute sir, 1 minute.
There is a white paper coming out here. I think someone has clicked something. Can it be? Yeah, right.
Hello sir. Yes sir, I am treating the 24-year-old child, CP child, and
Please tell us.
and his condition is totally worse. Even the patient is not able to sit, stand, and adductors are too spastic below the knee, means knees and ankle. They are such a worst condition. Patient forgot to how to move the ankle, means no motor control, means no motors, zero muscles power. But after stimulating with the two pens, what I experienced after stimulating with the brain and muscles pen, the spasticity is reduced, and the patient will ever the patient's range of motions is much improved, but the movement is not come. But
Movement
after
is complete. It is a neuropathic game. So when you continue to stimulate, the
yes,
myelin sheet of the nerve will improve, and then the
yes,
acetylcholine, dopamine, whatever hormones which are required from the brain to surpass to
yeah.
the muscle, if that conduction comes, the patient will improve.
Yes, sir. After conduction through the brain and muscles, then the range and the muscles spasticity is reduced. But after stimulating with the cognitive pains, the movement is automatically started. The muscles who lost the memory how to move, it automatically improved by the use of cognitive pain. It's my personal experience, what I see, what I judge difference between the pens.
Very good. So I told you some easy ways from how to recover the pain in different areas of the body. Even in tendinopathies, you can recover in sports therapy and all, you can recover the pain very fast. And this is how I wanted to teach you prolotherapy. So this time, an orthopedic surgeon will be teaching you prolotherapy. More questions? See, these are easy ways of recovering the patient. Don't go to the complicated methods, inserting anesthesia, and then again after some time the pain will come back because anesthesia effect is only for a shorter period of time. But acupuncture effect is for a longer period of time. You can see the patient has recovered.
IG,
Yes, sir.
did the patient stay there for 15 days?
No, patient do not stay. Most of the patients, those who are immobile, they come and go. OPD patients.
Or OPD, huh? I see. Okay. Very good.
Even you can recover depression. Lot of things you can recover. I can teach you a lot of things on hypnotism, how to recover all those things. So you have to integrate things. I've seen in, and today it has come to a notion that
You have autism case? We didn't see it
yes,
yet.
I've recovered many autistic child.
Oh, we didn't see it yet.
Autism child. Let me see. I don't want to make the class much boring, so that only these can recover. Once your interest comes, you can learn more from Google, you can learn from many places, you can learn from here. I have given the link of autistic child.
Hello, Pranam sir, Mukesh Rath बोलो.
हाँ रावत जी.
Sir, we can do something in deafness.
See, I have recovered cases of deafness, but it's difficult sometimes. Results are 40 to 60%. 40% cases you get results, 60% you don't get. See, people
Okay,
do
sir.
not come for this type of disease to us.
Okay,
People,
sir.
generally patients will come to you only for ortho and neuro cases.
Okay, sir.
And autism, CP, you can see.
Yes.
This is a child which was treated in US.
You can see ADHD autistic child, and you can see how beautifully he helps me in it. Only one, you see
He's a hyperactive
how
child.
aggressive the child was, and how beautifully he cooperates with me now.
Good evening, sir.
Can you complete this
Hello.
video? Can you complete this video?
Okay, sir.
He wants me to complete fast. So here you can see how a autistic child has improved
Two more. Beautiful level. You are unable to speak, now is speaking. You have been previously treated in United States of America. Which state you are treated in?
Arizona.
Arizona. How much did you improve there?
No improvement. I tried several things like biomedical treatment, like with supplements, oxygen therapy, and diet intervention, gluten-free, casein-free. All I tried.
You could see. You could see. I did not put the needle. He requested me to put the needle now. And you see how come. Now after this treatment, I think we are running in second month now.
Yes.
So, other than putting this needle, did I do anything else?
No.
How much activity has been reduced?
70 to 80%. And I am able to take him anywhere outside.
Now you can take him to shops and all.
Shops, anywhere. I can control him easily.
Earlier you were
Before
afraid to
even I stopped going out anywhere because of him. So I used to go only in the night after he sleeps or mostly online ordering. But now I am comfortable.
How is his behavior with you in the family? Calm?
He is very calm. I mean, he is following instructions. Whatever I say, he is listening. He is paying his attention, is improving. Activities like he used to focus on for 10 seconds. Now up to 1 minute he is able to do something. And his hand strength is improving. That recently
Most important is his needling procedure has improved. Earlier we used to take 40 minutes after inch.
Yeah.
Now you can see how beautifully it takes needle give, and now you can see his behavior. Srijan, what is your name? Huh? What is your name? What is your name? Srijan. Who is he? Huh? This one.
Little wide, little low.
Loud.
Louder.
Loud. Get picture.
Kati Chapu. She is your mother.
Saying Amma.
Who is he? He? Huh?
Huh? Doctor. So you can see he has started speaking. Now he will go here and again he will come. I told him this. Go there, do like this and come back.
That is why his strength is improved. Hands.
So now you can see a good autistic, a very significant improvement in autistic child. According to you, how much he has improved?
Behavior wise 70 to 80%.
Now you see shouting, jumping, hyperactivity.
All that is reduced.
Restless? No.
He's sleeping also. He's sleeping, but he's sleeping good.
He is sleeping good. So according to you, it's a significant improvement?
Yes.
What is his age?
12 years.
So in 12 years, did you see these improvements?
No.
Even
I
in-
gave up actually thinking like, no, he's becoming older, right? So I used to
Now
think
what
it's
problems you will experience now, you know, madam. Puberty changes when they are coming out. If he is aggressive like this, it is very difficult to...
So actually before I started, that's what started, the puberty changes. So it's very hyper. Like, he used to hit his
You can
head
close the
a lot.
video.
Even if I asked him to he would shout.
No, yes, tell me. Roni, what's your question?
Gee, actually, what did you do that the mainstream medicine cannot do?
I did the same thing what you have seen. I just inserted the needles.
And why can't the mainstream do something for 12 years?
Yeah, he was very autistic, very hyperactive, very difficult. Even in needle insertion used to take 30 minutes. Now you see, a little bit control on the diet and this. Now he is going to school.
So is there a OPD or in-house?
OPD. 5 minutes OPD, finished. The case is over.
So how many sessions?
They took number of sessions. 2-3 months they came. But now the child has started going to school.
So is it like daily or
Huh?
daily session?
It depends on case to case.
No, I mean, in this case,
No, you cannot say because these people, they come sometimes, they don't come sometimes. Yeah, they're family activities. You cannot say.
right.
So I don't plan with them. OPD, we don't plan anything.
So
Whenever
at
they
least
come,
once a
it's
week,
okay.
right? At least once a week, right?
Yeah, once or twice or thrice a week they come.
Yeah. So how many needles that you have shot?
I use only 4 to 5 needles.
Mhm. Good job, good job.
Namaskar, sir.
Yes, yes. Please tell me, sir.
Yeah, I have a patient who is around 35 years of age. He was got admitted in the hospital for the stroke
Huh.
and discharged after 7-8 days. He
Hmm.
lost his vision in between. So now
Oh.
he is recovered. So he's not able to walk properly, but he specially came for vision loss. So which are the points and how we can we
See,
reverse
these are
his
the typical
vision?
cases because you have to build a visual pathway between the motor cortex, eye, and the brain, and this is are not the points. These are the stages which you have to overcome.
So which is the pathway should I follow for this?
See, presently, you know the only one pathway. You follow that pathway.
Right. So how I can like work on this?
See, occipital lobe and motor cortex, and then the eye to the retina, signal processing. Once it is lost because of stroke, it hardly comes. Even if it comes, it's very difficult to see. But in my cases, we have bought the eyes also, we have bought the cases also, and we have recovered the patients also.
So I can refer them to you, sir. Patient is
You can
able
refer
to
them, but you cannot assure them for the eyesight
no
because
that,
they have
that
already delayed for too much for the retinal cells. The retina has 16 layers of cells. So if that 16 layers of cells, how many cells does retina have? 12 to 16 layers, right? 16 layers, I think.
right, right.
So if the retinal cells are damaged, recovery becomes difficulty. But in retinitis pigmentosa, I'm recovering.
Right. Even the patient is ready to come. So to whom should I contact to send you the patient
You
sent
can
at
contact
your
me
place?
directly.
Okay, so I'll text you on WhatsApp, sir.
Yeah, yeah.
Thank you, sir.
More questions? Ask questions, please. Ask question.
Hello,
Yes, tell me, sir.
hello.
Yes, tell me. May I know speaking?
Yeah, I just want to. Yeah, I'm Subhash Dhayal from India. I just want to
Hi,
know
please
in
tell me.
open wounds or in diabetic foot necrosis kind of cases.
Diabetic? Hello?
And
Hello? 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 I think the line is disconnected. Any other questions?
Hi, G.
Yes, tell me, Sarji.
Yeah, the stem cell that you use for chronic pain recovery, is it the same as for anti-aging?
Yes, yes, it is the same. It is autologous stem cells, but we have made it a very cheaper process. In India, it cost around $3,000 to $4,000, Singaporean dollars, but we made it in $100.
Yes, yes. So you mean also can be used for anti-aging?
Yeah, it can be useful for both CP children, and it really works.
And what about the administration location? Is it the same like on the lumbar or what? Where do you inject?
We go to intravenous and local.
Oh, intravenous, I see. Okay. And for diabetes also, right?
Yes, yes. We have got good results after stem cells and diabetes also. People are doing good.
And how soon they can see the difference?
It's difficult to say about the diet, the lifestyle. It's all a lifestyle disease. That's why I say, instead of reading, you ask your question, then only your doubts will be clear.
Right.
It's a lifestyle disease. Lifestyle disease has to be corrected by lifestyle.
Yes.
If you don't correct your lifestyle, you cannot learn this.
So is death possible for recovery?
See, I have seen people, the sugar has come in control, my sugar has come in control. My health has quite improved now.
Thank God.
Yeah, so all these things are there.
No, I mean deafness. Can it be recovered?
Deafness, no. Deafness is a different subject. Deafness, cochlear implant only is the solution, and it is very costly.
But I believe tinnitus should not be a problem, right?
Tinnitus, in 50% cases you get results and 50% you don't get.
Even with the stem cells? Huh?
No, no, we don't advise stem cells and tinnitus because we don't want to waste money where we don't get results.
Mm-hmm. Okay, thank you.
More questions?
Good evening, sir.
Yes.
Sir, what about autoimmune disorders, sir, like
The
psoriasis?
autoimmune diseases also can be revived. They can be recovered. And medicine-wise, they have only high steroid therapy. While going through this acupuncture and all, the pathway to recover the disease becomes easy. We have recovered in past Jargon syndrome and all. We have shown results. A patient who was bedridden who could not walk has started walking.
Okay. Thank you, sir.
G, another question.
Sir.
For vertigo, is there a possibility of recovery?
Huh?
Vertigo.
Vertigo can be recovered. You just need to see it is because of the ear or because of the cervical spondylitis or lifestyle. So you have to find out what is the cause of the disease, and according to the cause of the disease, you have to read the disease and the patient can recover.
So
Vertigo is quite recoverable. 80% vertigo can be recovered.
No need stem cells? Huh?
No. Stem cells are not for this thing.
Okay.
These are costly treatments. No. These were neuropathic cases and all.
Excuse me, sir. So what about mentally retarded patients, sir?
So you have to see whether they are CP child or medically retarded. You have to classify them. Most of the child, those who are CP also, they look like medically retarded. So it's very difficult to classify. Medically retarded, of course, is very difficult to recover, while CP child can recover.
Okay, sir. Thank you, sir.
More questions?
Sir, I'm Gandhi from Chandigarh, India.
Sure.
If you permit me, and kindly
Sure.
arrange a lecture on that difference between cerebral palsy and mentally retarded children diagnosis, treatment and management from modern medicine and as well as physical medicine and rehabilitation point of view.
Yes,
So
sir, you
that
have to
my
use
colleagues
your
would have.
earphones because your voice is very weak. We are not able to hear what you're speaking.
I remove my earphones.
You have to put your earphone close to your mouth.
Yes.
Yes, now please speak, sir. Don't remove your earphone. Please bring it closer to your mouth. More questions?
G,
Sir.
is stem cells good for dermatological condition?
Yeah, they are very good for pathological condition.
No,
Lot of research has been
dermatological.
done. Huh?
Dermatology.
Dermatology, we have not done much research on that, but it has been found that yes, it is effective on that also.
So what do you
But
think
whether
for?
the cost is less.
Yes,
If
but
it
what
is
do you
very
think
high
for
costly, you cannot afford.
psoriasis?
See, we use only 100 rupees, 100 US dollars for the, so you can afford.
Yes, yes. So what about you think for psoriasis?
Psoriasis, it's doubtful, sir.
Doubtful.
Yeah, psoriasis is because of stress of the brain.
And like hypopigmentation?
Dermatologically, I cannot say you.
Okay, thank you.
Sir,
Tell me.
how about macular degeneration?
Macular degeneration, you can recover. My power was minus 25, now it's minus 7, 8. So you must know how to recover it. But macular degeneration and eye degenerative diseases can be recovered because it's just a signal processing between the brain and the occipital lobe. So you can recover those diseases. It's nothing great.
With dry needles?
You have to see what kind of case it is. You have to examine, and then you have to go and make a plan on it.
Okay, thank you, sir.
More questions? You have any more questions? I have told you a very shortcut way of recovery the patient. I don't want to go to a very complicated method. If you go for complications, because your knowledge of muscles is international class, many people from Indonesia, Philippines do not know the knowledge of many of the muscles. So I took out a shortcut way by which everyone can understand and practice. Right?
Yes, thank you.
Right, Sastriji.
Any more questions?
G, one question. Does the stem cell help in the osteoporosis?
Yes, it helps in osteoporosis. The studies have found that stem cells help in osteoporosis.
So does that mean that they do not need the...
But it depends on how much you take. We give around 10 to 12.
I see. So they can stop the osteoporosis medication.
Yes.
Okay.
No need to stop the osteoporosis medication, but it can sustain the cases.
Because they need jab almost monthly or 3 monthly.
It depends on what is type of cases you are treating. It's very difficult to say without seeing the patient what plan of treatment should be accepted for the treatment of the pain. Generally, I have told you the general way how to recover a pain and paralysis.
Yes. Thank you.
More questions? Because I have always seen people want points. So this time I have given only points. No much explanations. Insert the needle, touch it, tenderness, and the pain goes. More questions?
So take a separate class on autism. If
Autism, yes,
possible.
we'll take the class. Yes, we'll take the class. Let me complete this course, we'll take autism. But autism class is very difficult because every autistic child is very difficult, different. Autism is the practical subject.
Something we learn because nothing is there. That's how it.
Yes, there is no way of treating autism. But then I have treated successfully, you can see autistic child.
There is lots of NGOs, lots of special schools. Means they spend 8 to 12 years. Nothing they can do. Just charging. Just the patients, parents just pay the money. Then after 12, the patient is around 25, 26 years. Nothing is going to recover.
Anyway, we can plan for that.
Thank you, sir.
More questions?
Excuse me, sir.
Yeah.
So there's a female child, nearly 14 to 15 years. She has excessive secretion of saliva.
Excessive secretion of saliva.
Saliva.
You have to find out the reason why there is it is. First, refer it to a pediatric doctor to find out what is the reason.
Okay. So her behavior is also somewhat like a CP child only.
Then in CP child, you will find excessive secretion. And this is one of the quality of that.
Okay, sir. Thank you.
So more questions?
Sir, may I speak?
Yes, please.
Sir, can we do brain mapping with you, sir? Is it possible in one of the lectures?
Yes. See, brain mapping with me, practical is a practical subject. Using brain stimulation, brain pain, brain, everything has to be specific. It's just like you are changing something inside the brain.
Right,
Your
sir.
stimulator is correct. If your stimulation is not correct, then you will not get the results. It's a practical subject. You must know, have the knowledge of little bit about the muscles. Right? First, the power of the muscles have to come. Then the muscles have to learn. See, power is not enough. Then you must learn how to walk. That is called PNF and integration of cognitive, means how to teach him to walk.
Right, sir.
Then putting strength on the limb. So everything is damaged in the brain.
Hello, sir. Sir, what was the result of the you are using the robotic hand? The result is good or just it's symptomatic?
Which one?
You are using a robotic hand on patient for the rehab of the hand.
See, symptomatic is just not symptomatic, patients have revived. But you have to go with brain stimulation.
But the outcome of the robotic hand is good or something
It's
you
average,
find?
neither good nor bad. If you use just robotic hand, nothing will come out. If you use it with brain stimulation, it comes up.
Okay, sir.
More questions? So we have completed a big chapter. Then we'll convert this chapter into a prolotherapy by the orthopedic surgeon. He'll very correctly teach you, those who come to the seminar, how to use the only dextrosaline to revive this. This is called PNIT, perineural injection therapy. So this is a good therapy people can use. Even acupuncture needles can be used on these tender points and people can recover. Okay. Any more
Yes,
thing you want to ask? Any more thing you want to ask? It is a very complex pain which I have taught you in a very simplest way. Without anesthesia, without injection, just with dry needles, you can insert the, recover the pain and patient gets long lasting relief.
Sir, can we say the NIBS, it is a one of the type of the artificial intelligence?
Yeah, it is a type of artificial, it is a neural network inside the brain. Establish a neural network. Until the network is established, it is very difficult for the patient to revive. That is why we say neuroplasticity exists in 2 to 3 months or 4 months. It is written in the books. Connectivity does not come so soon.
Yes, sir.
Okay then. Any more questions? Thank you so much.
Thank you,
Good
sir.
night, Sastri.
Thank you,
Thank you,
sir.
sir.
thank you. Good night, sir.
Thank you, sir.
We are grateful.
Thank you so much.
Good night, everybody. Have a lovely night.
Lovely. Greet
Thank you so
everyone.
much.
Down.
How are you?